I'm Sherif Wilson. I'm a consultant plastic surgeon from Bristol. I work in the NHS in Frenchay Hospital, but I do practice privately in the Spire Hospital in Bristol, also in the Bath Clinic, the BMI group, as well as the Winfield Hospital in Gloucester. I have been a consultant for 6 years. My main subspecialty is breast reconstruction, but I do quite a lot of cosmetic surgery too. Well, initially when I went to medical school, I always wanted to be a surgeon. And once I start to learn how to become a surgeon, I have one of my seniors, he was a plastic surgeon. And he came one day and he was doing this difficult operation when he moved some tissue across. And suddenly everything looked perfect to me. I am a very fussy person. I don't like cutting corners. And I realized the only way to keep me on my toes is doing plastic surgery. Because if you do one mistake, it will become apparent. If you don't do one stitch right, it can become obvious. So I do take my time. I like to do things in the way I like them. And if I'm not happy, I start again. And I thought plastic surgery is the only way to fulfill my desire to be very meticulous. I think for me, the satisfaction in my patient eyes, when a patient come back and said to me, thank you, this will make my day. I feel very proud when that patient said, we're delighted, or it changed my life, or it's perfect. I want to hear this all from my patient. And being a plastic surgeon, you hear this quite a lot if you're doing good work. And I make sure that my standard is always very high. I always consider a good plastic surgeon like a professional footballer. You have to have a very high level of concentration. You have to perform very well to win every single match. And for me, winning every single operation by my concentration and my dedication. My typical day starts very early. All my young kids wake me before 6 o'clock. And usually have breakfast with them, and then I usually go to work. I either operate in the morning or have clinic. When I operate, I usually start about 8 o'clock, and depend on the operating list, I usually finish about 2 o'clock, and then I do my clinic. I try to make sure that my clinic is not very busy, because I like to spend time with my patient. All my patients, when they come to my clinic, they have plenty of time. I make sure they are relaxed, they're not in a rush, and they spend as much time as I like. All of them too, I make sure that I come back for a second consultation, because I think it's so important for them to appreciate how the operations they have, all the pros and cons, and I make sure that also they don't feel under pressure to have an operation. I think the commonest procedure recently I have been doing is a tummy tuck operation. It's probably not on the top league of the BAPRAS and BAPS, but it's getting there and it become more common as part of body recontouring.